Thank you for taking the time to view our poster presentation on the topic of supporting the sexual health of people with dementia, enabling providers to support intimacy and sexual well-being of older adults. This is the voice of Caitlin Alick. I'm the project coordinator at the Behavioral Supports Ontario Provincial Coordinating Office at the North Bay Regional Health Centre. And I'd like to acknowledge my co-authors, Dr. Birgit Pianozzi, Dr. Rosemary Mangiardi, Christian McKibben, M. Tilking, Dr. Laurie Schindel-Martin, and Dr. Veronica Afonso. I'd also like to acknowledge our other working group members, our expert panel, students, as well as our funders, the Regional Geriatric Program Central, and the Alzheimer's Society Research Program, without whom this project would not have been possible. So beginning with some background information, sexual health is an important part of life for all older adults, including people living with dementia. However, for people living with dementia in long-term care, they experience many barriers to expressing their sexual health needs, such as a lack of privacy, separation from partners, and stigmatizing attitudes. We know that people living with dementia who express their sexuality in long-term care home environments often experience punitive actions, discrimination, and judgment. Healthcare providers express feeling unprepared and unconfident when it comes to supporting the sexual health needs of people in their care, and they've shared with us that the education that they've completed over the years rarely addresses this topic. So we sought to address this knowledge gap through the development of a 3-module free online program called Supporting the Sexual Health of People with Dementia. We used a multi-methods approach to develop the program, including a comprehensive literature review, consultations with healthcare providers, geriatric psychiatrists, and bioethicists. And we also piloted the first module of the program and used pre- and post-learning surveys to assess its impact, which informed the development of modules 2 and 3. So fast forward to today, and what we have available is a 3-module free online program that we released on Valentine's Day 2025. The program in its entirety is available on the Alzheimer's Society's AlzEducate website, as well as the Surge Learning platform. Module 1 is called Dementia and Sexuality, an Introduction. Module 2 is called Communicating with Long-Term Care Residents About Sexual Health. And Module 3 is called Understanding and Responding to Sexual Expressions of Risk. When we consulted with healthcare providers about the development of this online program, they emphasized to us the importance of having guidelines, tools, and resources available after the completion of the online program to help them put their new learning into practice. So modules 2 and 3 come with several accompanying resources, including guidelines, tools, worksheets, and conversation summaries and action plans. We evaluated modules 2 and 3 using a very similar approach that we used to evaluate module 1, which was through optional pre- and post-learning surveys. When we analyzed the results of our surveys, paired t-tests revealed that confidence significantly increased across the majority of the survey items. Our largest gains that we saw were in confidence in using tools and resources to engage in conversations with residents about their sexual health, as well as in describing and assessing responsive sexual behaviors. We also assessed learners' overall satisfaction with the program, and our results indicated that satisfaction was consistently high across all items, with average scores of 4 out of 5 in every category. In conclusion, the Supporting the Sexual Health of People Living with Dementia online program addresses a critical gap in education at the intersection of sexual health, dementia, and long-term care. By increasing access to evidence-informed, practice-relevant education, our program supports a more inclusive and person-centered approach to care for people living with dementia. And here are a list of select references, but a full reference list is available on the brainexchange.ca/BSO Sexual Health webpage.